Welcome to the Psychological Resilience broadcasts. Thank you for joining us today. I hope that you will have joined us before in the past. And if you have, you will know that what we do in these broadcasts is we like to focus on areas of work in the community where there are particular assets, particular groups working to support the mental health of local people in particular ways, and to think a little bit with our psychologists and psychotherapists who work in SLAM, how can we work with these people? How can we work with these community groups? Is there any value we can add? Are there ways in which we should be working differently to promote the resilience and psychological well-being of our local communities? And today we're going to be looking at honour-based abuse, and we have the privilege of hearing from Nirvana, who are a group who work with people who are victims of honour-based abuse. And we'll talk also to a clinical psychologist who has experience of working with people who have experienced honour-based abuse, and we'll think a little bit about whether the services as they are arranged at the moment are really meeting the needs of those people as best they can. And of course, we all know, don't we, that during the pandemic, people are stuck indoors, they're stuck with their loved ones, and there's a particular valence for people who are subject to honour-based abuse when they are at home with the people they perhaps are most afraid of. So we'll explore that in a bit. Before I get there, I'd like to ask you to consider the other opportunities for joining in with broadcasts. There is a broadcast that is from the Maudsley Learning, which is asking Black and minority ethnic people in Lambeth, Southwark, Lewisham and Croydon, are we doing enough? Are we doing enough for people with mental health problems, and what else should we be doing? So I think these are all opportunities for you, the audience, to get involved. If you can get involved in the Q&A chat and to help us think how we need to be differently, how our services need to be differently to better meet the needs of the people we serve. So without any further ado, I'm going to ask the guest speakers here to introduce themselves, and then we'll move into a bit of a Q&A until I get some questions coming from the audience. So Natasha, could you introduce yourself from Nirvana?
Yes, thank you, Alison. My name is Natasha Rattu, and I'm the director of Nirvana.
Do you want to just say a little bit about Nirvana?
Sure, yeah, absolutely. So Nirvana are a national charity, and we support victims of honour-based abuse and forced marriage. Nirvana deliver the government-backed national helpline on honour-based abuse. So we are a first point of contact for people who are considering their options, that want to understand a bit more about their experiences and know what is available for them by way of opportunity to escape. People don't necessarily arrive at our service in that place. Very often they want to talk about the issues and try and understand and get a sense of what it is that they're going through. So we deliver that service. We also deliver training nationally, and we work really closely with the government policyholders on this subject matter to ensure that this issue is embedded at every level, from strategic right to the front line.
Thanks a lot, Natasha. And your website is posted in the live event. And if anybody has any issues relating to honour-based abuse, I will post also the telephone number that they can contact. And Kevin, could you introduce yourself, and could you also introduce our hypothetical service user? Now, we originally were going to invite a service user to be part of these broadcasts, but we've really realised that this is such a sensitive area and people are so incredibly vulnerable that it doesn't make sense and it isn't safe for a service user to be present. So you're going to both represent yourself, I believe, Kevin, as a clinical psychologist, but also describe the voice of the service user. So Kevin.
Yeah, so my name is Dr. Kevin Venti. I'm a clinical psychologist working in Croydon. I'm the psychosis pathways lead as well, and I've previously worked in early intervention services, and that's where I've been able to work with a number of patients actually who've been victims of honour-based abuse and subject to violence. So I'm going to talk you through um, a person who's kind of a composite of all these different experiences that I've gained of working with different people. I'm going to call this person Zubia, and basically I met Zubia when she was around 17. She came into the early intervention service, and just for people who don't know, an early intervention service actually helps people who present with psychosis. So it's quite a complex mental health difficulty, and actually she started off needing support from CAMHS. And it all began really with Zubia's experience of her mother who tried to force her to get married. Her mother had found suitors for her, and this was against what Zubia wanted. And one of the things I remember Zubia saying was that lots of her friends were all preparing to get married, and lots of her friends also were not happy with that. And she, through her PHSE lessons and through sort of the media coverage that as there are reports of the good work that Carmen are doing and other organisations, she realised that actually in Britain she has got a choice over who she marries, and that she doesn't have to follow what the family are wanting. Basically, she presented with low mood, she had a lot of anxiety, and that's how she got support from CAMHS. And basically, she was referred to CAMHS from the school. The teachers in the school realised that she was struggling and met her. They provided some support with her depression and anxiety. But then what clearly happened was that she also presented with paranoia and more psychosis type symptoms, which is why she was referred to this secondary care specialist service. When she came to me, she had received quite a number of diagnoses, and one of the things I did was really try and find out what was going on for her. And it seemed quite clear that she was traumatized. She was experiencing a great deal of trauma. And this is something that wasn't quite picked up in the CAMHS, and it's something that I felt was actually key to her difficulty. So one of the things we did was we started working on the trauma, and that's when she started sort of sharing some of her difficulties growing up, how unsafe she felt. And one of the things that I remember saying was that school was always a really safe environment for her. It was a way in which she always felt like, okay, school was good because she was in a safe place. She knew what was going to happen next. As soon as schools broke up for the summer, and she would be isolated. She would often be sent to. She's British Pakistani origin, and she would be sent back to Pakistan, and it's there where she felt completely unsafe. She felt unable to kind of be herself, to go against or challenge some of the expectations that her parents and her aunts and extended family would expect. And so there was that general feeling of not feeling safe. And basically, Zubia, she was able to find out about Carmen Nirvana. She was able to speak to an operator who on the telephone, and they gave her lots of advice. They advised her to go and speak to the police as well, and she did, and that's when things started changing for her. And I suppose the reason why we're talking about her today as well is because she for me is an example of someone who's so resilient and has actually made such such progress with her recovery, and it's a story that I think everyone should share. So thanks for
that, Kevin. That you've brought the idea into the forefront of our minds, and I guess there are lots of questions I'd like to ask here. But first of all, maybe Natasha, can you tell us a little bit about, how many people in the UK experience honour-based abuse, and what do we mean by honour-based abuse? What are we talking about here? Kevin's referred to feeling very uncomfortable, but what are we talking about? What's the reality of that?
Sure. So honour-based abuse by definition is any incident or crime that has taken place whereby a family member perceives that that person has brought shame, and they therefore harm that person, whether emotionally or physically, to either restore honour or as a punishment for the shame that it's perceived that the victim has brought onto the family or the community or indeed themselves. In terms of numbers, it's a very hidden but thriving issue in the UK. Our helpline really is the only organisation that provides government data on this in particular, and last year we had 11,500 contacts to our helpline just for last year alone. And if we look at this year, we can see that numbers are increasing, particularly over the pandemic. We've had a real growth in contacts from victims directly, particularly around emotional support and having needs for surviving a situation in lockdown where, we think about the fact that they're locked in with often multiple perpetrators, parents, siblings, extended family members. It's made it exceptionally difficult for those people in that scenario. So it's, like I say, very hidden. And I would estimate that of what we know of honour-based abuse and its prevalence, it's significantly under what the reality is of how often it does go on. And we also need to recognise honour in the context of not just the motive for why an incident crime has taken place, but also from the fact that it acts as a barrier for many victims. The shame and the stigma compounds people to situations for much longer when they experience honour-based abuse, because they're ever so fearful of speaking out and bringing that shame upon their family or community. It is viewed as a form of domestic abuse, and that's really, really important for the audience to recognise, because it often takes place in a domestic context, in that the victim is often personally connected to the perpetrator, and the vast majority of our calls come from those people that are over the age of 16 as well. I think that also shows that for children who are particularly vulnerable going through this, that it is very hidden as an issue for them.
So that's really interesting. I mean, the prevalence of 11,500 people just being the tip of the iceberg is really quite startling, isn't it? And I wanted to ask you again, Natasha, if you could just say a little bit more about, I guess what we're trying to do is reach people as early as possible so that they don't develop the serious mental health problems that Kevin described. But what are some of the barriers to that, and what are some of the things that would help that? Because I think you've touched upon almost the idea that people are living with people who they care about not shaming their family, they care about their family. It's not a simple relationship, is it, where I guess it's not black and white for people. So how is it that you can work with people to enable them to really recognise that this is an abusive situation?
Yeah, you're absolutely spot on, Alison. We have to think about honour-based abuse in a perspective of, you have victims of this that don't even recognise that they are being abused because of the deep conditioning that takes place from a very early age. So we have people that are affected by this that think it's normal for their family to have a very strong degree of control over them, coercive control that is so strong that they just think it's an absolute norm that their families can make such significant choices for who they marry, what they study, what they they wear, etc. So I think we've got to think about a group of people here that don't even recognise that this is abuse. So in terms of key messaging, we've got to enable that person to recognise firstly that they are being abused and this is abuse, rather than a tradition or something that culturally some communities just do. So we've got to kind of shift that perspective into the fact that this is abuse. And then the other significant thing that we need to do when they're there is give them enough opportunities and reasons to reach out. And when they do reach out, we've got to ensure that we're meaningfully reaching in, because we overwhelmingly have many people who contact our service for counselling support, and we refer via the GP route and they go and seek that support, but then actually do a full cycle and come back to Karma Nirvana because the counselling that they've received has not been meaningful. And actually that can often make them feel re-traumatized when it's not been dealt with in a meaningful way. So there is a real gap in terms of understanding the complexities that Kevin alluded to around honour-based abuse. And that leaves many victims feeling that they're not heard, that people don't understand their issues, and they're just far too complicated to be worked with. So the starting point is really shifting the narrative for victims to recognise it. And when they do reach out, ensuring that we're reaching in meaningfully.
So there's real challenge here around cultural sensitivities, isn't there? And I imagine that the sorts of things that you might be alluding to there, Natasha, might be, you know, counsellors who want to sort of encourage more family work, families to resolve these issues amongst themselves, perhaps being a little naive to the degree of violence and the degree of potential harm that a victim could experience. So can you reflect a little bit on that? Because I'm wondering how we go about developing that competency in a context in which we're already very concerned that we're not properly meeting the needs of diverse communities and not properly being sensitive to them. How would you anticipate we would approach this?
Yes, so, you know, cultural sensitivities doesn't mean that we accept the unacceptable in any other circumstance. We've got to be looking at this and framing it in the context of what it is. If it is abuse, then we have frameworks to be dealing with it as abuse. We've got to kind of take away this cultural context, and we've also got to be very victim and survivor led and not make assumptions that they do want to mediate, or actually that our perceptions are that, you know, families are this, you know, loving, caring being, and actually in cases of honour-based abuse we do often see the opposite of that. And recognising from what the victim is telling us, you know, if they're talking about their family in a way that they are coercive and controlling in their behaviour, that they have all that control, this is essentially abuse. So we shouldn't be mediating or looking to reconcile a relationship where it wouldn't be healthy or safe for a victim to be having that relationship. And the problem that we have very often is we're working quite often with perpetrators who don't recognise that what they are doing is abusive. They view it under this cultural lens, or that there's some legitimacy around this because it's just a tradition of what communities have done for years and years and years. We've got to break that cycle. We've got to empower people affected by this to come forward, to speak out, and to know that actually they don't have to be part of that cycle and they can break it, and that there are lots of professionals out there that want to support them to do so, so that we change this legacy of abuse that gets handed down generation after generation for generations to come.
Kevin, I wonder if I can ask you about the experience of the service users that you've had contact with, and whether or not you know, they experienced some of this perhaps cultural naivety that Natasha's talking about, the sort of misguided but well-meaning kind of attempts to skirt over the situation or minimise it, or perhaps not appreciate the danger that people are in. Has that been the experience of the service users that you've worked with? And you know, what can we do about that?
Yeah, no, it is a shared experience. With many of the people that I've worked with, they felt that when they've sought help from or support from the police, it seemed to be sort of falling on deaf ears. Often police don't know what to do or how to help, and then and also, you know, that's unfortunately the case sometimes with mental health services. And one of the things that often happens, and that's one of the things I've seen, is that when people have say they are in an abusive relationship, so they've been married against their will, and they've struggled and they've ended up in mental health services, and then they've got an abusive husband or partner who is there saying, oh, she's got this mental health problem, and that's the focus. And what that does is it kind of takes her voice away, you know, from the picture. It makes it seem like it's her mental health that's driving this, and it's not that she's unhappy with the relationship or what's happened in her life. So these are the common examples. They do come up, and it's important to kind of be open to it. And I've often thought if these people could be helped earlier on, the outcomes could be so much better. And I know that in sort of school environment, they have new professions like children wellbeing practitioners and educational mental health practitioners, EMHPs, and I think it's those people that might actually come across some of the people that we're talking about now, and I think it's making sure that those kind of practitioners who maybe see people in school environments are trained and aware of this kind of difficulty, and also the presentations that young people may be coming with. I presume that, because one of the things that when I think of Zubia, I know that she said that she had these problems from the age of 12 onwards, and if she could have got support, I mean, at that time it seemed like she was mainly depressed and highly anxious, but then over the years it turns into something more chronic, and actually can end up being quite a complex mental health presentation. So I think it's about increasing everyone's awareness.
So that's really helpful, thank you. Easier said than done, I'm guessing. You know, if people are referred for mental health problems, we tend to look for mental health problems, not necessarily see the context in which they're operating. And if problems are starting as early as 12, but how are those young people going to access services? So my question to you, Natasha, is if you could wave a magic wand, how would you change services? What sort of services would you make available, and how would you make them available to meet the needs of these hidden children? And I've got a question from the audience also saying, would peer support be a part of that?
Yes, absolutely. Peer support is really critical in that respect, because it may be a peer, and only a peer, that a young person speaks to. I think also, just going on from the point that Kevin made, it's about being trauma informed. It's about being informed as to what is the root of these presenting issues, low mood, depression, etc. What is really going on here, and not being afraid to ask the question, because all too often we find that these cultural sensitivities, or this need to be, you know, politically correct, and we don't want to be viewed as racist, act as barriers for agencies, frontline workers, to meaningfully engage and get to the root of what's really happening for the young person. So that for me is really important. And I think you've also got to be thinking about the degrees of proximity. If you've got the victim at the centre of this, who are all those points of contact, such as teachers, such as school nurses and other professionals that they may come into contact with? And are we ensuring that they're equipped to understand the issues and ask questions meaningfully, and at least know where to refer a person to if it's suspected that there is an honour dynamic or honour abuse at play. And I think we also have to be mindful that victims don't come forward and say, I'm a victim of honour-based abuse. The onus is going to be on the frontline worker to ask questions to establish that, recognising, you know, their own bias for a situation, one, and recognising that they're asking the right questions to establish this, because if there are honour dynamics at play, it's then thinking about the wider ramifications for the victim, what then might make it more difficult for this person to speak out. You're thinking about the shame and the stigma and those barriers that might make it more difficult for a victim of honour-based abuse than somebody that isn't experiencing honour-based abuse. So you've got to be thinking about all those first points of contact for a person, and schools do play a real implicit role here. We've got to be mindful as well that we're not making judgments. We all have our own and carry our own judgments and our own bias. And I say this because I've recently authored a serious case review of a young boy that took his own life, and there were lots of honour dynamics at play in this particular case. And what was interesting was that because this boy came from a socio-economical family that were wealthy and perceived to be doing the right thing with an education focus, and there were no signs of neglect, despite the masses of honour dynamics that were very prevalent in conversations he was having with peers and teachers, the signs of honour-based abuse were completely missed. He didn't feel heard. So it's about making sure that we're hearing children properly, and importantly, not afraid to ask questions that might feel a bit uncomfortable. And if professionals want to have more confidence in how to ask those questions, contact us at Carmen of Honour, and we can help with how questions are framed so that professionals have that confidence to ask them.
So you've raised some really important points there, but one that really strikes me is it's not necessarily girls, it's not necessarily children who are very impoverished or otherwise disadvantaged. These could be strong, powerful members of our community, not the sorts of people that we would necessarily think vulnerable, and we need to be listening in a different way. So that's really helpful. I was wondering also if you could talk a little bit about any work that's being done with the communities as a whole to change the way in which these traditions, these family-based traditions, are playing out, and also, you know, what's the role of the police in that? What's the role of mental health services in those conversations? Natasha, maybe, and then Kevin.
Sure. So we're actually writing our communication strategy for the next year, and we've had to really focus on what our priorities are around key messages, because unfortunately we don't have a money tree to get all of our messages out to all of our intended audiences. And of course, the community and perpetrators are one audience. However, I think our primary focus has got to be victims and survivors of this abuse. We've got to enable them to understand this as abuse, and we've got to be working towards reducing the shame and stigma that exists that prevents them from coming forward. So that's where we're focusing our comms, and would really encourage other frontline workers to support us in reducing that shame and stigma for them, because I think the moment that we do that, we enable more people to come forward, and we don't just change things for that one person, we actually change it for a society of women and girls, because this is a gendered issue. It does affect boys, but it is heavily gendered. But we change an attitude where we make it more acceptable for people to come forward, and that's what we're working towards as a vision.
Thanks, Natasha. Kevin, any thoughts about how we work with communities as a whole to change practices?
Well, I think it's really important to increase awareness of this problem. I think shame is one of the big things that I had to work with some of the young people who presented with this problem, and I think it's really important that mental health practitioners in secondary care and primary care, and as well as GPs, police, etc., are all trained and able to ask those difficult questions, ask those maybe sensitive questions, and in a really curious, accepting way. I think that's one of the biggest things, and I wonder if for instance my young person Zubia had been asked those questions in a sensitive way whilst at school, then maybe more support could have been provided. And then obviously in a secondary care setting where we're then going ahead and having to kind of work retrospectively to try and work out what's gone on and how we got missed, and how to support them and rebuild that resilience and support that. So it is very much a training need, and I'd be very welcome to more training. I know I've had to work with this client group, but I think everyone can, in all settings, open to a bit more training that I think will equip us to be more curious and more sensitive, culturally sensitive as well.
Thanks very much. Well, we've come to the end of the broadcast now, and I'd like to thank you both, Kevin and Natasha, for your time and your insights. I just like the audience, if anybody would like some more information on, I know some people have asked for ways in which they can approach people who might be at risk of honour-based abuse. If anybody has any requests, please put your email address into the chat and we will get back to you with some contacts and some thoughts. Okay, so thank you very much, Natasha. Thank you, Kevin, and goodbye.